Roderick here for AirMaria.com. We're in Griswold, Connecticut, and we have a surprise visit from Dr. Paul Byrne, who talks about brain death and organ donation. How you doing, Dr. Paul?
I'm doing fine. Thank you very much. Glad to be here with you. As you have stated very correctly, for many years now I've studied brain death and organ transplants, and I'm here to share with you how these has been great progression at getting ways to get your organs without your permission.
Right. Wow. Now, this is a very important subject and ties in with all kinds of other pro-death things and the whole anti-life movement. You've been involved in that for a long time. You were the one who talked on the other side against Kevorkian on Crossfire, right?
That's correct. I was the first to oppose Kevorkian on national television on Crossfire after he killed the first lady at that time. Yes.
You got him kind of mad, right?
Yes, I got him very upset, and of course what I stated is that Dr. Kevorkian should receive the greatest and most severe punishment that the law can give him, because he did a great disservice by taking away the life of that lady.
Right. It's turning all medical science away from life and toward death, right?
Yes. Actually, much of medicine now has turned away from the patient as a person, and medicine now is the patient is a client, and the client gets a number, and then the number gets a diagnosis, and then the diagnosis treatment is looked up, and if there is a treatment, and there's much of medicine that is exciting, and if there is a treatment, that happens. But when there is no treatment, then it's a matter of finding a way to hasten the death and shorten the life of the person.
Now, this has been accelerating, this whole process of finding a way to do just that, to shorten the life of the patients, to get more organs, has been accelerating in the past few years. Now, there's new laws that have made that easier in Europe, right?
Yeah. Yes, the laws have already been passed in Europe in at least 8 countries, indicating that it's presumed consent. It's presumed that everyone has consented to be an organ donor in those countries. Now, that is coming here in the United States also. It's already been introduced in at least one state, but even before that, the revised Uniform Anatomical Gift Act of 2006 has already been passed in 30 states in the United States, and it's introduced in at least 10 other states to be passed as quickly as possible.
So you're talking 30 plus 10, that's 40 states. There's only 10 left at that point.
That's correct. There's only 10 left that hasn't already had something done about it, and I just found out about it recently. Actually, it's already been introduced in Ohio, and only the day before they were going to hear hearings did I know about it. And so it moves along quickly. No one knows about it, and what it is presumed intent. It makes everyone be a prospective donor unless they have in some way indicated that they refuse to be a donor. And of course, most people have no chance to refuse because they are not informed.
Right.
They're not informed what organ transplantation is all about.
So if the combination of not being informed and the fact that when you are actually so quote-unquote brain dead or unconscious at least, then you have no chance of really saying no.
Yes, you have no chance of saying no, and unless you have said no ahead of time, the language is a prospective donor, which is every one of us who is still living. In order to get organs for transplantation, they must come from living persons. They do this legally under the guise of what they call brain death, but brain death is not true death. Those are people that are still living, having their life supported by a ventilator, but they choose and decide to get their organs. For instance, whenever a heart transplant is done, it's the transplant surgeon who stops the beating heart, and then he cuts it out just at the last minute, because the heart and vital organs need circulation all the time. Once the circulation stops in 4 to 5 minutes, the heart is so damaged that it's not suitable for transplantation.
Right.
And it takes at least an hour of operating to get down to where they can take the heart out, during which time the patient is still very much alive. They paralyze the patient, so there is no moving and squirming when they cut into them to take the organs. But even when they paralyze them, the heart rate goes up and the blood pressure goes up, indicating a response to the pain of being cut on.
Right.
So this is a very serious matter, and everybody needs to know what's going on. Yet very few people are informed.
Right. Very few informed, and that's they're not being informed, and it's accelerating at an incredible pace. What's the when was the first state enacting the informed or assumed intent law?
I'm not sure of the first date, because by the time I heard about it, already 20 states had it.
Right.
And you know that I read and pay as close attention to these things as anyone possibly can, but already 20 states had passed it by the time I heard about the revised Uniform Anatomical Gift Act. The revised Uniform Anatomical Gift Act is set up to get your organs, to get more organs. Now, it isn't just with brain death that they get your organs nowadays. Those people who can't be declared brain dead because they still have brain activity, but they want their organs, what they get is a do not resuscitate order. And then the do not resuscitate amounts to taking away the life support, taking away the ventilator, until the patient becomes pulseless. Not until the heart stops, but until they don't detect a pulse. And then after 2 to 5 minutes, that becomes the signal to cut out the organs.
So basically, they aren't dead in a traditional sense. They're very much alive, and therefore, when they cut the organs out, you're basically killing a person.
Yes. Not only are they not dead in the traditional sense, they're not dead. They're still living. A person is living until dead. And brain death is not true death, and it never was, and it never will be.
Now we can argue back and forth, or people do argue back and forth about that, and exactly where is death. But you can't argue with this, that there have been people who recover from quote-unquote brain death. Right, and that's proof positive that that is not really death if you can recover from it, because you don't recover from death. Right?
Yes, that's proof positive, and of course, recently the young man from southern Oklahoma who was declared brain dead, and 4 hours later, when a nurse taking care of him again tried to stimulate him by applying a stimulus to his foot, and he reacted. And they stopped doing what they were doing. And of course, what happens with brain death is that that's not a signal to stop the ventilator, to stop the treatment. That's a signal to continue the treatment and even make it better, because they want to keep the organs in good shape, and they have to wait until those who are going to receive the organs are ready to get them, because once they cut them out, there's a limited amount of time till they can get them into the recipient. So the reason that young man was still getting life support is because those who were going to get his organs weren't quite ready yet. But someone made the observation, and so they changed the approach to treatment. And then, of course, they told his parents that he would just be a vegetable for the rest of his life. Well, I've seen him on television several times, and he's very much alive, and he's very concerned because he could hear them talking about taking his organs, and he was saying, please don't do that, and I wish you wouldn't do it. But he was saying that mentally, but he had no way to respond because he was unable to respond at that time, yet he could hear them talking about it.
Which makes you wonder how many people have been cut open and taken their organs out who would have recovered.
That's correct. And of course, you never know that, because when the signal is there to take the organs, then after the organs are taken, they're always dead. After the beating heart is stopped and then cut out, no one has recovered. On the other hand, studies that have been done in Japan and in Germany, where they don't take away the ventilator and the declaration of brain death, 60 to 70% of the patients have made complete recovery. This is very, very significant. These patients that they take the organs from, the first and major prerequisite is that they must be alive. They must be living. Because after someone is truly dead, there are no organs that are suitable for transplantation.
And so our only defense then, if aside from preventing some further legislation, which is already all done almost, is to have a card or a document signed that will help you to prove that you don't want to be a donor.
That's right. There has to be some indication that you don't want to be a donor. These cards I have printed, and you have them here at the Friary also. And what this card does is gives instruction that if you go in the hospital, call a Catholic priest. That's the most important thing. And then it says, I wish to live the lifespan given to me by God. I direct my treatments and care, including nutrition and hydration, however administered, be given to protect and preserve my life. do not hasten my death. Do not take any vital organ for transplantation or any other purpose. This needs to be signed and witnessed by 2 witnesses and dated. This kind of card is
That's the best defense, right?
Right. It's the only way that you have to defend against them taking your organs from you.
Well, that's all we have now, Doctor, as you get the main points across, and those are very important points.